So gum disease.
Yes.
What are the symptoms? And I guess the way you're treating it is much different than the way I guess 90% or more of dentists, doctors, periodontists across the country are treating it.
Yes.
You're using a laser.
Yes.
But what are the symptoms?
Okay, so the symptoms are, I'm going to kind of break this down into two ways. The symptoms that people have, they're possibly going to have bleeding gums. They're going to have bad breath. Of course, most people don't know they have bad breath. The spouse or someone has to tell them that. They have loose teeth. Maybe their teeth are shifting positions. And what I have seen in being a periodontist for over 25 years, these things happen subtly. So most
And there's
people,
an infection going on that's causing this, like a bacterial?
A serious infection, because we know now that periodontal disease is related to heart disease, diabetes, osteoporosis. So if you treat your periodontal disease, most of our patients tell us they feel better. They're healthier.
Because the infection's gone.
The infection is gone. It is an infectious disease. And it's serious. It's not just gum disease. So it affects the rest of your body. We have a saying in our office that we believe having a healthier mouth leads to a healthier life. And it's being proven out in research day after day.
So the way it's normally being done is correct me if I'm wrong, they're cutting back the gums, scraping this bacterial infection out, and you do it where you just have a laser that kills the bacteria?
Right. That's exactly right. So the way that most periodontists are doing, as you said, probably 90% of the periodontists, they're cutting the gum tissue, pushing it back, scraping the teeth and the bone, grinding the bone away, and then they stitch it back together. With a laser, what we're able to do, the laser is a fiber, and it goes in between the tooth and the gum, and it sort of bursts, and it kills the bacteria, it kills the infection, because it's an infection caused by bacteria. So with that burst of light and heat, it does away with that, and it removes the infected tissue, and then we're able to clean everything out. So just like the conventional surgery, we clean it all out, and then we use a laser again. It forms a blood clot, and that's how everything heals. If you cut yourself, you get a clot, and then your skin heals. The mouth is the same way. It's remarkable.
So the space around the tooth, you go around that?
All the way
clean
around
it
it. Yes. Get rid of the infection. Get rid of the disease that's there.
Breath gets better right away? Blood?
It should get better right away, because the infection is what's causing that.
Now, another thing you told me, which I don't get, that people that you used to do extractions on, you're able to save teeth now using the laser.
Yes.
How does that work?
Well, a lot of cases where we thought this tooth is hopeless, we're able to, by using the dental laser, by not just using the laser, but with adjusting their bite, because sometimes because like we said, periodontal disease, their teeth shift positions. So we're able to get their bite fixed, kind of like a hand and glove situation. That's better than banging together. That's not good for the teeth. So the laser is the major part of this, but adjusting their bite, sometimes we'll join teeth together, kind of like a fence has the slat going across that way. So we join loose teeth together. I see patients coming in that said, I need all my teeth out. Another periodontist told me I had to have all my teeth out. Well, oftentimes we're able to look at the patient's x-rays, check them out, and say, you know what? I believe we can save your teeth.
Does that happen?
All the time. And we're able to save the teeth.
People that were told, my teeth have to come out, they see you and you say, we could save these teeth.
Oftentimes. Unfortunately, sometimes they are too far.
Oftentimes, like once a week, once a month?
I would say certainly once a week we're able to see somebody
that's a big
that we
deal.
can do that. We can save the majority of the teeth.
So there are people, I'll put you on the spot, that are getting their teeth extracted right now in your town that you probably could have saved them.
I'm sure. I'm certain of that.
Using a laser and the combination of therapies.
Yes. Yeah. And we're able to do grafting procedures. We can add bone back. It's
so
incredible.
No more loose teeth, bleeding gums, bad breath. Go around them, and I guess they have to get to you early, right? Well, isn't a little bit of blood normal when you're flossing, or okay?
You know, I think that's what patients think, because often...
Isn't that true that a little bit is okay?
No, it's not true. Because I will use this analogy with our patients, Randy, because they do see that. You know, it starts out as a little bit, then it's a little bit more, so it's kind of like aging. You know, I still feel like I'm 18, I'm 54, but in my mind, you know, I still think I'm young. So they see these things over time, and they don't really realize how significant. But I'll ask them, I'll say, well, pretend tomorrow you got up and used a Q-tip and cleaned your ear, and you looked at it and there was blood on it. Now, do you think, oh, that's a little blood? That's probably not a big deal. I think you would be calling your doctor saying, my ear is bleeding. The mouth is the same way. We should be thinking the same thing. Your body is alerting you there's an infection. It's trying to help itself by bleeding, getting rid of that infection. It's also showing us that there's an infection in there.
Now, is this true that all the bacteria in your mouth, I guess, now can go into your bloodstream?
Yes, yes. A lot of
Is that part of the problem
That's part of the problem. The relationship between that infection and your heart. You know, most people who come in and get their teeth cleaned, if they've had a heart issue and they have a joint replacement, they are pre-medicated. That just means they take an antibiotic before they come in. So the heart doctors and the orthopedic surgeons knew long before, there's bacteria in the mouth. We don't want that to mess up our heart valve replacement or a joint replacement.